Right. So if you have read and understood, considering it's surgical pathology patient, kindly tell me how would you address the issue to the patient?
I will address this patient that it's a highly malignant carcinoma, and
Patient would not understand malignant. What is malignant? Can you describe, please? Can you define malignant?
I will. It is malignant can be defined as when the cells are cannot be differentiated as a normal cells, and there is neomorphisms, and cytoplasmic nucleus ratio is altered.
Okay. Can you please tell me what are the types of gastric carcinoma that you are aware of?
So there are 3 classifications: WHO classifications, Lauren and Bourne classifications. According to WHO classifications, there is papillary adenocarcinoma, tubular adenocarcinoma, mucinous adenocarcinoma, mixed adenocarcinoma. According to the Lauren classification, there is intestinal type and diffuse type. And according to the Borman classifications, there is fungating and polypoid growth, ulcerative growth, diffuse infiltrative growth.
Okay, Linitis plasticus infiltrative. Okay, right.
Yes.
Can you please tell me what type of carcinoma is signet cell carcinoma?
The adenocarcinoma is known as signet cell carcinoma.
Okay. Can you tell me how common is the adenocarcinoma, or what is the most common type of gastric carcinoma?
Adenocarcinoma is the most common carcinoma. It is about 95%.
Okay. Is it diffuse, or if you can describe it? Okay, can you tell me the pathogenesis of the gastric carcinoma? How does it occur?
Okay, usually gastric carcinoma occurs by the Helicobacter pylori infection, which causes chronic gastritis, which leads to metaplasia, and this leads to dysplasia of the cells, and which leads to carcinoma.
Okay, can you define dysplasia?
Dysplasia.
How would you differentiate dysplasia from metaplasia?
Okay, in case of metaplasia, there is changing of the cell type from one cell type to another cell type. Like if the lining of the stomach,
yes,
the lining of the stomach is columnar due to chronic irritation. When it is changed to squamous, then it is known as metaplasia. And dysplasia, when these cell differentiations along with the invasion of the basement membrane and the cells can be differentiated, then it is known as dysplasia.
Okay, can you please tell me what are the risk factors, if any, for gastric carcinoma?
Okay, the main risk factors is the Helicobacter pylori infection, then chronic atopic gastritis, smoking, alcohol, usually nitrosamines, then meningeal disease, blood group A, family history of HNPCC, and familial adenomatous polyposis coli.
Okay, how can one confirm their diagnosis? What are the investigations available?
Okay, in case of gastric carcinoma, we will do at first CBC, then barium swallow, and then tumor markers CA72-4.
Okay, what are the treatment options which are available or can be offered to the patient with gastric carcinoma?
If the patient present us with the early stage, we will go we do gastrectomy, whether it's total gastrectomy or partial gastrectomy. But if it is the patient present with the metastasis, then we will go for the palliation, like we will do the feeding jejunostomy and pain relief by using opioid and palliative chemotherapy and palliation of ascites by repeated tapping.
Okay, what are the modes of spread of gastric carcinoma?
What are the
mode of spread of gastric carcinoma?
Okay, the gastric carcinoma usually spread to the lymph nodes, like it spread to the celiac nodes, then it goes to the prepyloric nodes, then pyloric nodes.
Okay, can you tell me the prognosis of gastric carcinoma after treatment? How would you
about 5 years survival?
Yes. Okay, can you please tell me, right, what are the complications that can result after the treatment, surgical treatment of gastric carcinoma?
Okay, in early complications, there will be hemorrhage, infection, anastomotic leak, and in case of and pancreatitis and cholecystitis. In late complications, there will be dumping syndrome,
yes.
Vitamin B12 deficiency, metabolic bone disease, and there will be recurrence.
What are the types of dumping syndrome that you know of?
Dumping syndrome is 2 types. One is early dumping syndrome and another is late dumping syndrome.
Yes. Can you describe more? When is it early and yes?
Usually early dumping syndrome occurs 30 minutes after eating, and late dumping syndrome occurs 1 to 3 hours after eating. In case of early dumping syndrome, when the food is eaten, there is it is rapidly transit to the duodenum, and there is hyperosmolar carbohydrate. So water will transfer from the intravascular compartment to the intestine, and there is low blood pressures. There is abdominal pain, diarrhea, and tachycardia and postural hypotension.
Okay,
but in case of late dumping syndrome,
gastric carcinoma, usually
the patient will present with the hypoglycemia.
Okay, yes, you were answering correct. That's why I interrupted you. Sorry. Gastric carcinoma normally presents with paraneoplastic conditions. Can you mention few?
Ma'am, gastric carcinoma?
No, presents with paraneoplastic conditions. Can you mention few?
Yes. Acanthocosis nigricans.
Yes.
And dermatomyositis.
Okay, good. With the presence of gastric carcinoma, there are also some characteristic features. Can you mention few? Like these are the characteristic features by which you can tell that it can be gastric carcinoma.
The patient will give history of weight loss, loss of appetite, and loss of appetite. And on examinations, I will find that the patient will anemic, and there will be
the characteristic one. The supraclavicular fossa, there is one lymph node. What does it call? I wanted to have
varicose lymph node, ma'am.
Yes, varicose node. Okay, and there is another sign and one Crookenberry tumor.
Succussion splash.
Precious sign and then Crookenberry tumor. What that is?
Yes. Tertiary sign and Crookenberry tumor. Yes, ma'am.
What is Crookenberry tumor?
Crookenberry tumor, ma'am, is a
when it spreads to
when it is spread to the ovary
in female patients
or around the umbilicus.
Yes, good. Yes, these are the characteristic things which happens especially in. Okay, can you please help me and read this image? Please. What are you looking at?
This is a slide.
Slide of what? Which stain has been used, and what are you looking at?
Hematoxylin using stain is used here.
And what are these? What does signet means? Signet means green light. Okay. What are these cells? Can you see?
No idea.
Yes, this is your homework for tomorrow. You'll tell me tomorrow. Definitely.
Okay, ma'am.
This slide has
Okay.
been taken from where and what does it signify?
Okay, ma'am.
Right, thank you. Because in pathology, it's all like slides or images. This is what they'll show you and they'll ask you. So at least basic,
Okay.
one should know. Thank you.